somebody told you before surgery that the surgery you were having would turn insane people into idiots, would you go along with the surgery or would you not? Today I will be speaking about why psychosurgery is not a smart choice for dealing with mental retardation or mental illness. Before I go into my main topics, I'm going to quickly explain the types of lobotomies that are performed. There's the prefrontal, the transorbital, and the frontal. The prefrontal, they stick a medical tool called a leucotome through your ears and they scrape out parts of the white matter in your brain. The frontal, they saw part of your brain out through cutting this off and then using a saw to cut out the brain. In a transorbital, they take an ice pick, which is used to chip away ice, and they stick it through your tear ducts up into your brain. They hit it with a hammer, and then they swish it around a little bit. Okay. My main topics that I will be talking about today are, number one, psychosurgery is inaccurate and dangerous. The results of psychosurgery will change your psychological being and your physical health. And third, there are other means of treatment for the mentally ill besides psychosurgery. Psychosurgery is inaccurate and dangerous. In the National Geographic, an article called "The Rise and Fall of Psychosurgery" says that the procedures were done blindly, meaning they didn't even know where they were hitting the brain. So since that was the case, it produced mixed results in the fact that the patient either got worse, stayed the same, or died. One of the famous stories is the sister of John F. Kennedy, Rosemary Kennedy. She had a lobotomy performed, and she actually became more vegetable-like after her procedure, and she spent the rest of her life in a mental institution. The lobotomy is least ineffective with schizophrenics. In another article by Robert E. Jones, he says that the surgery is crude and inexact, and they put rubbing alcohol in your brain and they left it there. They didn't clean it, they didn't remove it, they just left it there, which I think is disgusting. Because of its inaccuracy and the crudeness of it, you can imagine that the results of psychosurgery will be pretty extreme, physically and mentally. My second point, the results of psychosurgery will change you mentally and physically. In the same journal article by Robert E. Jones, the patients were very uncooperative, they had poor comprehension, they were very hostile, and they had post-operative convulsions. A journal article titled Consulting Psychology, it states that the frontal lobes, where most lobotomies are performed, is not significantly related to mental function, but motor function. So, where people were trying to fix mental function, they weren't even doing anything because it had nothing to do with the mental part of your brain. Patients also became very lethargic, they lost motor function, and they became more vegetable-like, so they depended on their loved ones to take care of them. My third main point is that there are other means of treating the mentally ill besides reverting to psychosurgery. In the National Geographic, The Rise and Fall of Psychosurgery, they say that there is an antipsychotic drug called phenothiazine. You may know it as just thiazine. It is also known as the chemical lobotomy, and also chlorpromazine, which is another antipsychotic drug. According to Dr. Rochelle Hansen, who is a psychologist in Grand Forks, North Dakota, she said that there are other natural ways of dealing with mental illness, including cognitive behavior therapy, yoga, meditation, systematic desensitization, and as we have all seen from commercials, there are medications for depression and anxiety, and there are also new medications for schizophrenics. Before I conclude, I would like to review what I have said today. In my first main point, which was psychosurgery is inadequate and dangerous. These were performed blindly. They were used with tools that are not even medical tools, like the ice pick, which is used to chip away ice. Also, that they weren't calculated very well. They didn't know where they were hitting the brain. They didn't even know what part they were taking out of the brain. My second point that the psychological effects are, and then they will change you. People became more vegetable-like, lethargic, uncooperative, hostile to their families and friends. And my third main point, which was that there are other means of treating the mentally ill, which is cognitive behavior therapy, prolothorazine, different yoga, meditation, etc. I would like to quote in my personal opinion, the best medicine that you could do for someone with mental illness is to be their friend and help them through what they're going through and try to understand what they're doing. I thank you all for coming out here today to listen to my speech, and I hope that I have better helped you understand the negative and harmful effects of psychosurgery. Thank you.